Hi, I'm Chloe, and my presentation is about what's going on while running in the hip joint. First things first, we're going to be looking at some visuals and biomechanics of running, specifically at the hips. We're going to go ahead and watch this video. And as you can see, there's a line going basically from the top of his hips down to his foot along the femur and attaching essentially at the top of the pelvis. And this is what we're going to be focusing on because this is the flexion and extension of the hip joint along the sagittal plane. So the hip joint is the articulation of the femur and pelvis. It attaches to the axial skeleton to your legs and feet, also known as your lower extremities. The hip joint is a ball and socket synovial joint. The acetabullum, also known as the socket, is located on the pelvis. And the ball is on the femoral head, and I'll just mark those. So this is your socket, and then this is your head. And then in between there is just some fluid that helps cushion your joints. So the hip joint enables a really large range of motion, especially when doing flexion motions. And these motions include flexion, extension, abduction, adduction, external rotation, internal rotation, and circumduction. And in running, your hips flex and extend along the sagittal plane, acting as the fulcrums of the legs while running. All right, so we're going to be talking about the major bones and muscle groups involved in running mechanics at the hip joint on the slide. Here you have the spinal cord, and you don't normally think of it as a place involved in hip flexion or extension, but a lot of the muscles involved in this movement, their origin is on the thoracic and lumbar spine. Same thing with the tibia and fibula. Don't really think of them as muscles that would be involved in hip flexion or extension, but a lot of muscles insert on the top of the tibia. Over here is a lovely thing of the top of a femur. And then over here is a pelvis, and right here would be approximately where your hip socket would be. And then up here are kind of all the major muscle groups, the abductors, quads, hip flexors, adductors, glutes, and hamstrings involved in hip flexion and extension. And we'll get a little more into more detail in those muscles in the next slide. All right, here are some muscles involved in hip flexion. I'm not going to go through all of them because there are quite a bit, so I'm just going to kind of go through some of the more major ones. So the first one is the psoas major. It's right here. As you can see, its origin is actually on the spine, and then its insertion is on the top of the femur. And its function is the flexion of the hip, and it can also help laterally rotate the thigh. So next we kind of have the tensor fasciae latae, or latae, and this one runs along your IT band, and it also really helps with the flexion and extension of your leg. And this is kind of one of the muscles really responsible for if you have pain in your leg or your IT band after running. This is a biggie. And then my last one that I'm going to focus on is the gluteus medius, because it also plays a huge role in not only hip flexion, but also hip stabilization while running. So probably the most important muscle for hip extension is the gluteus maximus. It is a very big, large, and powerful muscle, and if you're someone who wants to really improve their speed while running or make sure you're preventing hip injury, I would recommend strengthening your glutes. And all of these are essentially muscles in your hamstrings that enable hip extension. And then this is your abductor magnus. It's not necessarily something that you'd automatically think as a hip extender, but it does play a role, as well as it also helps stabilize the pelvis and keep your stride nice and linear. So one of the most surprising things that I found out during this research project was just the vast differences between male and female pelvises. I don't know, it's even more interesting because I do a lot of my running with guys, so I obviously get to see the differences in our strides quite often. So according to a study by the University of Waterloo, women are 2 times more likely to sustain a running injury than men are, and this is mainly attributed to the differences in male and female pelvises and bone strength. And the bone strength is more in older women or women who are either calcium or estrogen deficient, so it has less to do with bone structure and more to do with like nutritional factors and hormonal factors. But here's a lovely photo of, this is a female pelvis right here. And then over there is a male pelvis. And as you can see, like the female pelvises are much wider, they're much shorter. There's a shallower pelvic cavity, and our pubic arch is 80-90 degrees versus a male pubic arch is only 60 to 70 degrees, and this is to allow for childbirth. But it means that the angle between our femur and our pelvis is way different from the male angle between the femur and the pelvis. So for women, it's 16 degrees, for male, it's 12 degrees, and this just basically results in a running stride in women that moves more along the coronal and frontal plane, so there's more abduction and adduction, side-to-side movement versus perfect like linear movement. And this non-linear movement makes running less efficient and induces greater stress on muscles that stabilize the hips. and any part in the hip joint in women. And here are some muscles that commonly get injured down here in women because of that stabilization issues. And a great way to prevent this is just really making sure that you're strengthening your glutes and your obliques and your abdominal muscles. That will really help stabilize your hips if you're having issues. All right, next I'm kind of going to go through some really common running injuries or injuries that can be pre-existing but that running kind of exacerbates. And there's actually not a lot of severe injuries associated with running, I think just because it is kind of a movement that our bodies have been made and designed to do. So we're going to be looking at more severe injuries that aren't necessarily associated with running, but more of just injury of the hip joint in general. But these are more running-based hip injuries. So the first is bursitis. And so what is it? Bursitis is the inflammation of the fluid-filled sacs that cushion our joints. In runner, the bursa on the greater trochanter of the femur are commonly inflamed by repetitive strain and pressure. So the treatment for this is just rest and reducing the inflammation using ice or local steroids to allow basically that additional fluid and swelling in the bursa to drain. And then also stretching and strengthening your gluteus minimus and medius and IT band to reduce the strain placed on the femur and hip joint, either through stretching your muscles or through strengthening them to improve stability. So there's hip arthritis, and actually the occurrence of hip arthritis in runners and non-runners is the same. So there's a big myth that if you run, you're going to have arthritis in your hips, which is not true at all. However, if you are a runner and you do have arthritis in your hips, chances are you're going to notice it a lot more than the average person because you're going to have a lot of friction between your pelvis and your femur joint, and that's going to cause a lot of pain when you're running. And so the treatments for this is rest, applying ice, taking pain medication, and then also cortisol, which is an anti-inflammatory injections may be needed if you're having a lot of pain, and also hip surgery, which we'll look at on the next slide. And so this is pretty general this is a general kind of type of injury, but muscle strains and tendinitis in the hips, and this could be really any muscle that's contributing to either flexion or extension in the hip. And runners do commonly overuse these issues, and one of the most kind of complained about muscles in runners are hip flexor strains. So this could be for example, the psoas major. And so basically the treatment for this is either rest, anti-inflammatory medication, hip flexor and quadriceps stretches, and then also exercises that will strengthen your hips that include flexion and extension. And then your last one is the iliotibial band syndrome. So this is also known as your IT band, which is also super common amongst runners. So this is caused by the repetitive flexion of the hip and knee, and symptoms include pain in the hip, thigh, and knee, and actually most commonly in the knee. But the reason I mention this is because the IT band attaches at the top of the hip. So you actually feel the pain in the knee, but the problem might be more towards the hip. And the treatment for this is just rest and anti-inflammatory medication and stretches. All right, so here's just a slide looking at hip injury prevention and treatment for runners. Here you have a lovely cortisol anti-inflammatory drug molecule. Here you have ice packs, ibuprofen, which is a really kind of common pain medication. Here you have a lovely picture of your rectus abdominis and obliques, which are great muscles to strengthen if you are having problems in your hip because it's going to improve your hip stability. Here are some major muscle groups that you should work on strengthening, and then here are some kind of common exercises that will strengthen these muscles. So you have different squat variations. This is an IT band stretch. This can also both be a hip flexor stretch, and it can also help strengthen your glutes. It's a glute bridge. Here's some dead bugs, so this will kind of also help you strengthen those flexion muscles. This is a hamstring curl, and this will help you strengthen those extension muscles. And this is a lovely stretch for anyone who has tight hip flexors. And here's a little slide on serious hip injuries and treatments, and none of these are really caused by running unless something bad happens while running, like you experience a fall or an accident. It's more just serious hip injuries and how to treatment than anything kind of associated with running. So the first one is hip replacement surgery, and this is really common if you have arthritis. So essentially what happens is if you have a hip joint with arthritis, they go ahead and replace it with an artificial joint that will, so there'll be less friction between your hip and your hip socket, and then that will kind of reduce the pain that you've been feeling. And this is often done with metal and plastic components that drill into the femur/acetabulum, and this is kind of like a last resort treatment. So if you have really bad arthritis in your hip, this is kind of the last thing that they'll do or try to relieve your pain. And then the next thing is labrum surgery. So the labrum is a tendon that attaches, it's right here, it's pretty tiny, that attaches your femur to your pelvis, essentially. and it has really limited blood supply. So once it's torn, it is torn, and it's usually torn by movements that involve extension. And it is, because it has such limited blood supply, it's really difficult to repair without surgical intervention. Doctors will either reattach the tendon to the pelvis using plastic anchors, or if it's not as serious, they'll trim away any frayed muscles and tendons that may be causing friction and or pain. And here's a look at kind of all of my references, page numero uno and page numero dos. Thank you for watching, and yeah.